Senator Blunt Rochester.
Thank you, Mr. Chairman. Dr. Monterez, thank you so much for meeting with me and taking the time to discuss issues that are so vitally important to our country. I want to follow up on Senator Murkowski and Senator Murray's comments and questions about the importance of vaccinations. In a couple of months, parents in my state of Delaware and across the nation will be checking their children's vaccination records before they go back to school. Kids will receive vaccines against polio, measles, mumps, rubella, and the chickenpox to protect them and others from diseases, but also to comply with the state's vaccination requirements for public schools. In fact, it is said in all states require children to receive certain vaccines before attending school. Do you know how much a routine childhood vaccine costs without insurance coverage?
I do not, but I'm happy to look into that and follow up with you.
Polio is $44. MMR is $95, chickenpox $183. In fact, when you total up the cost of vaccines for a child to start school in Delaware, it would be about $1,200, which, as you can imagine, really is important to families right now. Especially, you know, a question was asked by Senator Sanders even about this reconciliation bill and the impact that it will have on families. The thought that it is estimated that through cuts in Medicaid and SNAP and other resources, some families could see an average of a $1,600 cut in their budget. And at the same time, you put on top of that the potential for a $1,200 increase in vaccinations if we're not doing the right thing. The good news is that today, before this bill passes, most children can get routine vaccines for free because Congress requires insurance coverage of vaccines recommended by experts, members of the Advisory Committee on Immunization Practices, ACIP. And the Vaccines for Children program as well makes it affordable for children across our country. However, these programs only, their coverage is dependent on recommendations from ACIP. And so you said earlier that vaccines save lives. Doctor, do you agree that vaccinating against deadly diseases like the measles has reduced childhood mortality?
Yes, it has.
If ACIP were to be removed or remove their recommendations for a vaccine or fail to recommend a vaccine, generally are insurance required to cover those vaccines?
I'm sorry, can you repeat the question?
What I'm trying to get at is if it's not recommended, would insurers be required to cover it?
So look, I don't, if I'm—
It's kind of a yes or no, really. The answer is—
I'm sorry, can you, the question is if a vaccine is removed from the childhood schedule, is
the bottom line is right now there's a lot of confusion out here because of what's going on with the firing of the ACIP members. There's confusion, and what we don't need as kids are about to go to school is confusion, concern about the cost. And so I think it's really important that this be an area that you focused on. And I'm really concerned that we don't put parents on the hook for thousands of dollars. So will you commit to not deviate from historical norms and keep routine vaccines free for America's children?
Vaccines absolutely save lives, and if I'm confirmed as a CDC director, I commit to making sure that we continue to prioritize vaccine availability to help mitigate health risks.
1 minute because I'm running out of time. And when we met, you told me during our meeting that you didn't believe that the ACIP members had conflicts of interest. That was the justification for Secretary Kennedy firing all of them. Do you, and members asked, do you disagree with him on anything, which you did not say you did or didn't. Do you agree with Secretary Kennedy's decision to fire all 17 ACIP members on the basis of conflicts of interest?
So look, the American restoring trust in public health is a critical priority. For me, it's a critical—
Doctor, I would really just love an answer. Do you agree with that?
I agree that the secretary had to make a decision related to ensuring that the ACIP could be supportive of restoring public trust in decision-making.
I thank you for that. I have legislation called the Vaccine Act. I think we need to make it clear, Democrats, Republicans, it doesn't matter. This is about the health and safety of our kids. We should not be unilaterally firing experts who have been vetted and who create confidence and trust, and then replacing them with people that just today we learned one of the secretary's nominees has now been really busted for conflicts of interest. So again, I hope my colleagues will join me in the Vaccine Act, and with that, I yield back.